Good morning. Today we are going to discuss about general anatomy of lymphatic system. The competency is components and functions of lymphatic system. Lymphatic system consists of a network of vessels. It exists nearly in all tissues of the body and in the lymphatic organs. Lymphatic organs produce immune cells. Components of the lymphatic system are lymph. It is the recovered fluid from the tissue. Lymphatic vessels, they transport the lymph. Lymphatic tissue consists of aggregates of lymphocytes and macrophages. Lymphatic organs, they consist of immune cells and are surrounded by capsule. Functions of lymphatic system are fluid recovery. The fluid recovery from the capillaries continually diffuses into the tissues. Fluid from the capillaries continually diffuses into the tissue spaces. Capillaries are able to absorb 85% of the tissue fluid. Remaining 15% is left out. The task of lymphatic system is to extract left out tissue fluid and return it to the systemic circulation. Any interference in this task will result in lymphedema. The tissue fluid collected by the lymphatic system is called as lymph. Immunity, another function. While attending to its task of collection of lymph, it picks up foreign cells from the tissues. On its way back to the systemic circulation, the lymph passes through stages of filtration in the lymph nodes, and immune cells stand as guard against foreign cells. If the immune cells detect anything potentially harmful, they activate the protective immune system or immune response. Then another function is lipid absorption. In the small intestine, there are special lymphatic vessels called lacteals, which absorb dietary lipids. Then we go to study the competency, structure of lymph capillaries and the mechanism of lymph circulation. Structure of lymph capillaries. Lymph flows through lymphatic vessels. They are similar to blood vessels. Lymphatic system begins with microscopic lymph capillaries, as you can see in the picture. Lymph capillaries are present in all tissues of the body except in cartilage, bone, bone marrow and cornea. Lymph capillaries is closed at one end. It consists of a sac of thin endothelial cells that overlap each other. The sac is adhered to the surrounding tissue, which prevent them from collapse. Lymph collecting vessels converge to form large lymph trunks. Mechanism of lymph circulation. The mechanism of lymph flow is similar to venous flow except that it has no pump. The lymph flows slowly and at a low pressure. The primary mechanism of lymph flow is by rhythmic contraction of the lymph vessels, which contract in response to fluid stretches. Valves of the lymph vessels prevent backflow. Lymph flow also occurs during contraction of the skeletal muscles. As the lymph vessels are packed in a facial sheath along with the blood vessels, the arterial pulsations also rhythmically squeeze adjacent lymphatic vessels and contribute to the lymph flow. Respiratory pump also plays a role in the flow of lymph, just as venous return. And at the point of lymph collection, point of lymph collecting ducts entering into systemic circulation, the force of systemic flow also helps in the lymph circulation. Then the concept of lymphedema and the spread of tumors via lymphatics and venous system. The fluid recovery is the primary task of lymphatic system. Over the course of day, the tissue fluid accumulated will be around 2 to 4 liters and about 1/4 of plasma proteins. One would die if that much of water and protein is not returned to the bloodstream. Lymph recovery. Even partial interference in the lymphatic system can lead to severe lymphedema. Lymphedema of elephantiasis is due to blockage of the lymphatics by filarial larva. Lymph vessels are blocked in cancer due to blockages in the lymph nodes and after surgical removal of lymph nodes as lymph pathway is closed and removed respectively. Spread of tumors via lymphatics and venous system. Many factors influences whether primary tumor spread via blood vessels or lymph route. The peritumoral lymphatics are by default pathway to tumors are incapable of crossing blood endothelial boundaries. There may be active mechanisms for attracting tumor cells towards one type of vasculature. Thank you.